GvHD is a tricky disease to treat. It's multi-system, multifactorial, and can manifest in very different ways in different patients. Part of the big problem is getting to the chronic GvHD patient early, making the diagnosis early, and initiating therapy very early. Once chronic GvHD gets advanced, some of the fibrotic manifestations become irreversible. So really our biggest challenge is really getting our first-line therapies to work quickly and effectively and to prevent the long-term sequelae of the chronic GvHD. We've learned a fair bit about the biology of chronic GvHD in recent years. We've discovered new pathways that might be involved in T-cell activation and activation of other cellular components. So for example, the use of ruxolitinib with the discovery of the JAK pathways being critical in GvHD, the discovery of the ROCK pathways and compounds targeting that pathway in chronic GvHD. So the biology is fundamental to our ability to treat patients in the clinical setting. And the two go hand in hand. So we've been very lucky that in the last few years we've had several drugs approved for the therapy of GvHD. Ibrutinib was the first drug approved for the management of steroid-resistant chronic GvHD, and ruxolitinib has now been approved for the management of steroid-refractory acute GvHD. We suspect that KD025 is likely to be the next agent to go before the regulatory agencies, but we have lots of other drugs in development that might eventually be approved. The mainstay of treatment in chronic graft-versus-host disease, unfortunately, is steroids, and the steroids are used for long-term, particularly in patients with multi-system chronic GvHD. These agents have lots of side effects, so we do need to monitor for the side effects of steroids, bone loss, diabetes and other metabolic abnormalities, and other chronic problems. Avoiding them by incorporating novel agents into earlier chronic GvHD therapy will hopefully bypass some of those problems in the long term. So we've learned a lot at this meeting about the influence of other factors in chronic GvHD and in acute GvHD, so the influence of the microbiome, novel other pathways. There's been quite a bit of interesting information we've learned here.